So what the NeuFit has done tremendously in our practice is we've been able to show them huge gains and immense amounts of value on day one. Immediately, people who walk in and they're limping and all of a sudden they're walking out after one treatment with no limb. Or, we bring a pain score from an 8 down to a 3 in a matter of 20 minutes.
I'm Garrett Salpeter, and I believe that the most powerful and transformative way to help people recover from pain and injury, heal from trauma, and reach their highest levels of fitness and performance is to focus on the nervous system. In this podcast, we'll share knowledge from the frontiers of neuroscience and inspirational stories of how applying that knowledge has empowered people from all walks of life to heal, adapt, and grow.
Welcome to another episode of the NeuFit Undercurrent podcast. I'm joined today by Angie and Jason. Angie and her husband, Joe not pictured here. They are the founders and owners of Apex Physical Therapy in Fort Myers, Florida. And Jason is the director of performance. So thank you, Angie and Jason. Thank you both so much for being here.
An honor. Thank you.
Thanks for having us, Garrett.
Yes, it's my pleasure. So Angie, first question for you. Can you tell us please a little bit about the history of Apex, how you and Joe got into owning your own facility, and just a little bit of the origin story?
Yeah, so I'm going to go as quick as I can through this part because we will be actually celebrating our 15-year anniversary of Apex in October. So
congratulations.
History there. Thank you. But basically in 2005, it started with us packing up a U-Haul with everything that we possibly owned in the state of Illinois out of Chicago and moving to Fort Myers, Florida with the dream of establishing our own physical therapy practice. So we were just two kids on a mission to do it and we did. So we'll fast forward a little bit to more pertinent to what we're talking about today. 2017, being in Southwest Florida, we were hit in late 17 with Hurricane Irma. And that was a huge reset button for our practice. Our practice had been a just general outpatient orthopedic based center. We dealt with a variety of patients and were largely referral based from physicians. After Hurricane Irma, it just really opened our eyes up to putting more of the things we can control in, controlling more of our controllables, I guess, and really changed our vision of Apex. One of those things being direct to consumer marketing, and the other big thing being taking our practice in the direction of an avatar patient, which was the athlete. And more specifically, the CrossFit and or Spartan race sort of athlete. Joe and I have had the pleasure of competing and doing a ton of Spartan races together. So that was a little bit of where our passion lied, as well as working closely with coaches and people in the CrossFit community, us participating in CrossFit as well. So it just, the passion just aligned so well there. And so that was our direction, full speed ahead since 2017. And then I had the great pleasure in 2018 to be introduced to Garrett and NeuFit technology. And the blend of having this technology, this kind of market differentiator, so to say, this catalyst to push us in the direction of these higher performing, athletic, driven kind of high performance individuals. It just seemed to just go so well together. So after went to Austin and got to actually train with Garrett and meet his family. I knew it was a perfect match. So now here we are. It's 2020. I didn't even have back then an athletic performance director. We didn't even have an athletic performance program, and now I do, and I'm so happy to have Jason with me, who's also been trained with the NeuFit, and basically we've been able to just open up our scope to go all the way from rehabilitation side, addressing the patient, and then moving them all the way up through into kind of the client, return to sport, elite performance, taking them all the way through that spectrum, and utilizing the NeuFit technology throughout that whole continuum as well.
That's awesome. Thank you so much for that. And I love how clear you are, and how you mentioned you became a really avatar focused, really tightly focused business, focusing on people who have similar passions to you and Joe, so you can really relate to your avatar, to your ideal customer, ideal patient, and you can speak their language, they speak your language, so you're really able to to work with them in a very powerful and meaningful way because of that relatability. I love that. And I guess I have to ask, are you doing this episode instead of Joe because you won the last Spartan race? Is that you beat him in the last race? Is that you earned the right? just kidding, of course. But
I might have a few more medals, but we won't go there.
I love how you two do that together. We see your posts on social media and different things, and you two definitely walk the walk. I mean, you put in the work and continue to push yourselves, and it's awesome to see. So I commend you for that, for not only helping others do it, but leading by example and really doing it yourselves. And I think that's another reason why you're so able to effectively serve that specific avatar. And Jason, I want to ask you real quick, because you have this kind of more strength and conditioning, fitness oriented background. Want to ask you a couple things, about what it was like to come and work in a physical therapy practice, and also what it's like incorporating the Neubie into that strength and conditioning paradigm. So I'm throwing a couple things at you at once here.
Sure. Yeah, I think the easy answer for both of those is it's made me better in the strength and conditioning realm tenfold, I would say. Just understanding the continuum of care from a physical therapy aspect back to sport, just to be able to see that progression is, I'd say, invaluable to my success as now a strength and conditioning specialist, coach, performance coach. And then the NeuFit just adds another layer on top of that. It opened up so many more avenues for us to be creative and expedite the process that we're trying to accomplish, for sure. So in terms of expediting the strength gains or dysfunctions and imbalances, it's been an incredible experience so far. Yeah.
And are you seeing people who start as physical therapy patients and transition exclusively, or do some people come in just for fitness training also? What's the blend on that front?
Yeah, it's a little bit of both. We'd say it's a natural fit for them to transition to me through physical therapy, because we are seeing a lot of those athletes now. So having that interaction with them, even through their therapy, has been beneficial. I jump in and just kind of introduce myself. Everyone kind of knows what I do here. And then they see that as the end result to be transitioned to that. It's like a graduation. Mm-hmm. And then in terms of the continuum of care, it's all similar. And I think this is important, because it's not only is this an important part of the practice, I think it's very necessary in physical therapy today to have it, because I think physiological, it's the same benefits in terms of what we're trying to accomplish.
Oh yeah. I think we could do a whole podcast episode, and maybe we will, on the overlap between truly effective therapy and truly effective training, and how, really it's in my belief, a very artificial distinction to call something training. I mean, there's some differences, but so many of the goals are the same. Whether you're trying to recover and heal damaged tissue in an injury, or you're trying to stimulate the body to repair and rebuild muscle and connective tissue after a workout. I mean, it's the same rebuilding, repair processes you're tapping into. You're always trying to improve movement, motor control, coordination, flexibility, or range of motion. I mean,
absolutely. And it's not so obvious that even mobility and strengthening is I think is interchangeable as well.
Mm-hmm. Yeah. So what is that transition? I'm thinking if I'm a physical therapist and I'm just listening to this for the first time and I have a more traditional practice, and I'm asking you, well, how receptive are your, if your patients are coming to you for physical therapy, if my patients are coming to me for physical therapy, how receptive are they going to be to, transitioning to training? Normally they see me and then they might come back for a tune-up once in a while, but when they're healed or when their insurance benefits are up or whatever, they're usually gone. How receptive are patients to actually staying on and doing more services within the practice?
So I can speak to that first. I think it all goes back to the value that we're able to provide to them from day one. So we're, both Jason and I share the same vision on just always giving as much as we can and providing our clientele with the best value we possibly can. And I think as long as we are going down that same lane, it's much more of a natural transition. You said at the beginning, we both walk the walk. And Jason is a CrossFit coach as well. Jason participates in a lot of athletic events. And so they see us as, hey, if Angie and Jason say this is going to be beneficial, then, I think this is really going to be beneficial. So, there is a certain sense of, growing that rapport, and they have to know, love, and trust us. And that just comes with doing your very, very best and giving them as much value as you possibly can on each occasion.
That's awesome. I think that walking the walk is so important, leading by example, showing people what's possible. If they put in this work and follow these steps, they can get to this point, and they know they're more confident they can get there because you've done it. You're showing them it's possible. So that's awesome. One other unique element about your practice that I just want to ask about a little bit. I know that Angie, your husband Joe, co-founder, co-owner, recently became certified in ultrasound diagnostics and is able to do some very sophisticated diagnostics of muscles, tissues, nerves. Can you talk a little bit more about that unique diagnostic capacity that you have there now?
Yeah. Thank you, Garrett. Quite an accomplishment for him. He finished a 2-year residency program and sat for a board certificate in which he just recently got his passing results in June. So he is now a certified electrodiagnostician, which basically gives him the ability to perform EMG and NCS. So that's nerve tests, nerve conduction studies, and electromyography in the same manner and with the same skill set that a physiatrist and or neurologist would perform these tests. So that is really cool. And he's also currently going through his residency program to become a fellow of musculoskeletal ultrasound. So meaning that he'll have his independent ability to do his own read reports and everything, doing diagnostic ultrasound as well. With the ultrasound, we're able to look at pretty much most all tissues. I know we're talking a lot on the nerve standpoint, but we're able to really see nerve, like what we can talk about, like the median nerve at the wrist. We're able to actually look in and trace and draw out how the diameter of that nerve to determine what normal values are or if there's some dysfunction happening there. And we can do that throughout, many nerves throughout the body, around the joints most specifically. And then of course the EMG test that has been just paramount in a patient comes in with any type of neurological signs and symptoms. We want to make sure, to what extent the nerve damage is, because that is a different treatment approach depending on what we have going on with that nerve and where. Quite possibly they could come in and we think it's musculoskeletal, but it's not. It's actually a neurological dysfunction. So it also can really help us with differential diagnosis too.
That's awesome. So I do want to ask specifically how the Neubie has impacted your practice, how, you mentioned 2017, you made the change in your kind of marketing and strategy and messaging. 2018, serendipitously timed, we got to connect and you incorporated the Neubie. I definitely would like to know for you, what has changed there? And that can be in terms of outcomes. And then, also I'd like to drill down a little deeper from the general and talk specifically about how it's impacted some of those particular cases where you've had, peripheral nerve damage or different things. But we can start with the general. How would you say that incorporating the Neubie has impacted Apex?
So from a general standpoint, I think I will go back to using that market differentiator. It really has set us apart from other practices, other outpatient physical therapy, personal training, chiropractic, any of those entities, and has set us apart, in that field. I think that's one of the biggest things. Also giving us a reason to kind of direct market to our public and our community as an entity on, hey, come in and try. We have this technology. If you've been unsuccessful with this, unsuccessful with that, we have this. We have something different. You haven't tried this before. We have this elite technology. This used to only be professionals. Now we were number 2, to have this as a physical therapy practice. And being able to give that messaging has just, from the business side of things, has just been a huge impact in allowing us to grow and serve more people.
If you're ready to supercharge your practice, listen to this. Garrett and Team NeuFit have just released a new online course entitled Introduction to the NeuFit Method. In this detailed 8-hour course, you'll gain mastery of the fundamental techniques in our practice, including muscle testing and activations, nerve glides, and joint articulations. You'll also get introduced to our patented direct current stimulation device, the Neubie, an incredible machine that's empowered professionals just like you to help their patients heal, adapt, and grow faster than they ever thought possible. To learn more, go to www.neu.fit/learn. And now back to the show.
Awesome. And then from a patient experience perspective, how is it, once you get them in the door, how has it impacted, from before, pre-2018 to post, how has it impacted treatments, outcomes, generally from a clinical side?
So I can speak from the clinical side of it, from the PT side. So what we know to be true in our profession is right around the 3rd visit is where a patient will drop off. So if you haven't really gotten them to see the value in the work that you're providing them in those first 3 visits, most highly that's when you're going to see a drop off rate and you're going to lose the potential to help that person. So what the NeuFit has done tremendously in our practice is we've been able to show them huge gains and immense amounts of value on day 1. Immediately, people who walk in and they're limping and all of a sudden they're walking out after 1 treatment with no limb. Or, we bring a pain score from an 8 down to a 3 in a matter of 20 minutes. And when you're able to show them that type of data, especially in those first few sessions, from the patient side of things, now we've been able to convince them that we're going to be able to help them. And we have the opportunity to continue to do that and get them to their greatest potential. And obviously from the business standpoint, then we have even more opportunity to continue to serve them as well. So that's how I've seen it from the PT standpoint. I'm sure Jason can kind of chime in too.
Yeah, I would say that the success in terms of using the NeuFit is also directly correlated to referrals and how much new business is coming in to the facility as well. One person, leaves here after strength and conditioning with me for a couple of months, and people are asking them, how did you see these gains? What's changed in your program? And so that's how we get some referrals that way as well. So it ties in full spectrum in the business for sure.
Can you talk about your pull-ups?
Oh, sure.
Sample really quick, Garrett, because I'm so proud of him in this one.
Please.
Yeah. So we have one client in particular that's we would consider very active, does a lot of boot camp and even personal training outside of here prior to, working with me. She started with some hip pain in physical therapy, transitioned with me. We got rid of that, and she's running fine. But then she had a lifetime goal of wanting to be able to do a pull-up. But even being so strong and active in normal life, she had never been able to do so. We started about 8 sessions into like a pull-up kind of protocol with the NeuFit, and she got her within a month and a half. She got her first pull-up. So
Nice.
yeah, I mean that's one of many kind of stories like that, but it's a lot of fun to see it come to fruition.
Yes.
That's awesome.
Yes.
Yeah.
And she probably, I would imagine, correct me if I'm wrong, but probably was able to do it without necessarily having to, pack more muscle mass on her lats, because it's there's both the amount of muscle that we have, and then there's also oftentimes, more importantly, that neurological skill of being able to activate more of the muscle at the correct time to express the strength that's there. And if you're making those changes in 8 sessions, that sounds like it's probably too short to build a ton of new muscle. It's probably more like learning the skill of muscle recruitment and coordination and activation, right? Yes,
absolutely. And obviously it's not like we didn't throw the pads just on the lats every time she came in, so we're moving them around. We're doing just as much pressing as pulling, and just trying to reprogram those muscles to be firing properly.
Awesome. So it wasn't even, it was more of a general program. It's not like it was 8 sessions of purely pull-up focused work anyway.
Right. No, it wasn't. Yeah. We're just coming in doing pull-ups. Yeah. There's a lot of, different things involved.
Yeah. Wow. Very cool. So in terms of specific instances like this, that's a great one. Thank you for sharing that. Angie, I think you mentioned that you had one that was share-worthy on the rehab side as well, in terms of how the Neubie was able to impact nerve injuries, and also in the context of having this sophisticated way to diagnose and measure peripheral nerve damage and different capacities that you have there. Can you talk a little more about that? I think it was one particular instance, right?
Yeah, thank you, Garrett. Jason and I are both very proud of this gentleman, because he's kind of been what our vision is, as far as he has come in from the rehabilitative side, and now he's actually currently working with Jason from the performance side on just continuing to get stronger and function better in life. But he came to us back in 2019 in January with acute pain. Basically, long story, he had an episode of oh my goodness. It's the herpes virus, shingles. I'm sorry. He had an episode of shingles, which ended up resulting in severe nerve damage in his right lower extremity. Okay.
Wow.
So he came in on a walker, his wife basically holding him up, just couldn't even almost walk across from our entrance to the table, severely debilitated. And this was almost an overnight change, was a, normally functioning, walking, lifting, boating, gentleman. Back at the end of January, we did an EMG study to actually determine what was happening. And from his lumbar 2nd to 4th level, it was determined that he had severe. So from mild, moderate to severe is how it's determined, severe damage of the axon of the nerve. And that it was acute. This is resultant of what just happened, with this episode. Most specifically, it told us also that there was a decreased recruitment. Basically, none of the motor units, if anything, maybe one little itty bitty one left firing, mostly affecting his VMO, his adductors, and his rectus fem. So we're like, all right, what are we going to do here? NeuFit. That's exactly what we're going to do here. So we will kind of fast forward. We did some creative things with him. We did some of the traditional mapping and some of that work. But then what we also did is begin to utilize his pad placement along this specific presentation, meaning we had him hooked up to VMO, adductor, rectus fem, and utilized him beginning at the 500, but then going into the 55 current, specifically targeting what we knew neurologically needed to be primed, right? So let's fast forward. We used the Neubie on him probably 2 to 3 times a week, going through rehabilitative. We retested him about 10 months later via EMG. He now had what was determined as moderate axonal damage. So we actually had improved some of that damage that was happening, as well as now where he only had those itty bitty 1 motor units firing, he was showing normal recruitment patterns at all of those muscle groups.
Wow.
Which
Fabulous.
in turn, so that's like the science-y behind it. Functionally, by this time in October, no walker. He was walking independently. And we were, beginning to build him up into higher level functional movement patterns. And then fast forward to the present, he's currently with Jay, who Jason can kind of comment on what they're currently working on, because he's gotten to the point with me that from a rehabilitative standpoint, he's doing fantastic. He's doing amazing. So we retested him just a couple weeks ago to look at where he was at, and it came back with a normal study.
Oh
Meaning
my
if
gosh.
somebody were
Fabulous.
to EMG, if somebody had no idea what this gentleman's history was and just walked into an office and said, hey, can you EMG test me? They would have shown a normal study. The only thing that stuck out was the way that the amplitude will show up on the meter or on the report that they see. But what that indicates is that there was actually collateral sprouting of those nerve fibers. So, when we break that axon in half, we all know that it doesn't grow together all beautifully and pretty in the same exact way that it was before. But what can happen through the correct feedback is that we began sprouting, that neural tissue began sprouting and finding a way and moving all of these little roots along to get that connection back again to begin utilizing those muscles. So, he is amazing in what he does functionally, and then what the science behind it has shown. And then Jason gets the pleasure of working with him now.
Yeah, and super proud of him for sure. He's pretty much now 3 times a week, athletic performance only, and he's pushing 80, right? But he's doing
80 years old.
Yeah, 80 years old.
Wow.
He's doing a program that I would expect for someone, half his age even, to have a tough time going through. He's continually making new bounds and leaps that, if you walked in and saw him a year ago, you would just say, he's never going to be doing these things. There's no chance. But he continues to show up, and it's awesome to see.
That's fab. Oh, Angie, go ahead.
I'm sorry, Garrett. I just have to add on that being able to take him from where we took him from to when I said to him, from a rehab standpoint, you're ready to transition to Jason. A, I don't think that would be possible without utilizing the NeuFit technology. And B, without having the NeuFit technology, I don't know that we would have the ability and for him to see the value of us continuing to impact him in the way that we've been able to. Like I said, he comes in and shows up 3 days a week to get on the machine with Jason because he's seen what it could do from a rehab standpoint. And now, as an 80-year-old gentleman, he just wants to
live life better. Yeah.
Yeah. He just wants to be the best he possibly can. And I look over and I see him back squatting with the bar on his back. And it's amazing.
Yeah, and just last session he wanted me to take measurements of his arms and legs and stuff because he's like, I want to see how much more strength I can add in the next 3 months. So it's fun.
Oh my gosh, what a wonderful story! Thank you so much for sharing that. I love how it highlights the full arc from very early stage rehabilitation through later stage rehab, early stage fitness, all the way through this entire continuum that you're able to offer there. And, people, like you said, it's super rare to see that kind of new collateral growth and sprouting and axon tissue. And, it's already rare, let alone at 80 years old, when most people probably think that, it wouldn't happen at all, or it's at least extremely unlikely. And yet you've shown that it can. And that highlights, for me, some of the early research that I did in this kind of breadcrumb trail that I've been following for the last 15 years to, been developing this, technology and different things. And, it highlights how that difference between direct current and alternating current, and how, at least in animal models, and we also certainly believe in humans, direct current has been shown to have some benefits on regrowth and regeneration of bone, muscle, connective tissue, and nervous tissue. And it seems like it's, it's not just theory, like we're actually seeing it in real life, which is awesome. So thank you so much for sharing that. And that's really powerful.
Yeah.
So if people are listening to this and they want to look up Apex and they want to follow along with your Spartan races and your rehab patients and the clients that Jason's training, what's the best way to check out Apex and to follow along with your adventures?
Oh, thank you, Garrett. We have adventures for sure. Social media, probably Instagram is probably the easiest, the best. On Instagram, we're Apex Physical Therapy SWFL. On Facebook, we're Apex Physical Therapy and Concepts in Rehab is our Facebook. Always feel free to message Jay or I on either one of those channels. And we'd be sure to answer any questions or help out if anybody needs any help along the way or just wants to chat about anything. More than happy to do so.
Awesome. Thank you so much. And I have to admit, you're talking about avatar and identifying your ideal customer. I have to say we have found our ideal customers in you and Apex.
Aww.
Because we love physical therapists and trainers, practices that share our passion for this mission of really being able to help people and being able to leverage technology to do it in a more powerful way, but not in a way that replaces, where they become reliant on the technology, but in a way that's really humanizing rather than dehumanizing, in a way that allows us to access that potential that we have inside of us. And I hear that passion coming through. So I want to thank both of you. Send my regards and gratitude to Joe as well, please. And so give them a follow. Apex.
Oh, thank you so much, Garrett.
Apex Physical Therapy SWFL on Instagram. And thank you so much.
Thank you so much for listening to the Undercurrent podcast. If you enjoyed this episode, please consider leaving a review and be sure to subscribe to stay up to date as we release future episodes.